Hi, my name is Thomas Fackler. I am a licensed massage therapist here in Glendora, California. Today, I would like to show you a brief explanation and demonstration of lymphatic drainage and its benefits. The lymphatic systems start from water molecules that gather waste, unwanted products, and interstitial fluids between the cell into the capillaries. From there, it will go to the lymph vessels. By this time, it would be about 8 to 10 cells thick. The clear lymph fluid flows into the collector called angions, which look like a string of hot waving chain, which are closed in one end to prevent backward flow and carry the fluid to the lymph node. The node size range from as big as an olive, and it could be as small as the head of the pin. The nodes have a large concentration of white blood cells. Nodes filter and purify lymph and serve as the home for lymphocytes, which destroy foreign bacteria, viruses, abnormal cells, including cancer cells. Then it drains to the trunk on the left and right subclavian vein and mix with blood before return to the heart. There are two primary lymph organs, bone marrow and thymus. Bone marrow produces antibiotics and lymphocytes such as B cell and T cells. B cell mature in the bone marrow, and T cell migrate to thymus to mature. Spleen filters the foreign substance out of the blood and store red blood cells. Tonsils are big lymph organs that defend against bacteria that come through the mouth and keep the throat healthy. Tonsils produce mucosal associated lymphoid tissue or mold. Adenoid, known as pharyngeal tonsil, they protect the body from harmful bacteria, viruses. They're fighting off infection. Your appendix helps with body provide good bacteria to the large intestines and keep the colon healthy. Lymph nodes filter and purify lymph fluids. Lymph vessels carry lymph fluids to the lymph nodes. Capillaries carry interstitial fluids to the lymph vessel. I have Bernadette here to help me out with the demonstration for lymphatic drainage. First, I will open the lymph system by gently pressing on the subclavian vein right underneath the clavicles, also known as the collarbones. As you may notice, there are duplications of light pressure, which could be repeated up to 5 times, and the direction of the stroke always goes toward the nodes. The rhythm of the stroke slow like an ocean wave because most of the lymph vessels are superficial, which means they are located right underneath the skin. Therefore, it doesn't need to be pressed very hard. Now I'm moving up to drain the nodes in the neck area. This helps with cold sinus problems or flu. Sometimes nodes in the neck area swell up because the nodes retain fluids and overload. Manipulation of limbs will help drain fluid in this area and help recovery times become faster. Swelling of nodes is not bad. It just indicates that the nodes are fighting off infections. We have twice as much of lymph fluid as blood, but the lymph system does not have a pump. Manual manipulation of lymph drainage, good deep breathing, and the movement of the muscles helps the flow of lymph fluids. The step of this type of body work start from proximal, which means closer to the trunk of the body, to distal, away from the trunk of the body, and turn the step around for rinsing process from distal to proximal. Now I'm draining lymph nodes in the axilla area on both the left and right side of the body. Lymph drainage helps lymph fluid flow to its full capacity. The increased flow helps with the circulation, chronic fatigue, reroute the stagnant fluids, reducing first and second edema or swelling, and it removes interstitial fluids, fats, and proteins in the entire body. Now I'm draining the lymph vessel in the arm to the lymph nodes in the axilla area, then to the inner elbow, and then the forearm, up to the hand, and then fingers. Then I turn around for the rinsing process. As of this moment, I am draining the lymph nodes in the abdominal area, which have majority of lymph nodes and located deeper than the nodes in the neck, axilla, inguinal, or iliac area. It will need to press deeper than normal, but I still have to be very gentle. This will deal with the digestive system, waste substance, nicotine, food color, and drain to the nodes. As you see that I'm very gentle with the pressure, and I make sure that the stomach is feel nice and soft. Then I move down to drain the node in the iliac area. Very gentle pressing. After that, I move down to drain the nodes in the inguinal area, which located in the inner thigh. Then we'll start to drain the lymph vessel in the legs, down to the popliteal nodes underneath the kneecap, then the leg, the foot, and finally the toes. There are so many benefits of lymphatic drainage, and it is a big part of the immune system. Help defense against the foreign cell as well as cancer cells. Lymphatic drainage is helpful for all ages, and it should be done every 3 to 4 months, which will keep your health in check. It is also beneficial before or after any surgery, but make sure to drink plenty of water before and after the session to get the full result of this body work. Contraindications of lymphatic drainage. If you have acute fever, please wait until the fever stops before having any lymphatic drainage done. Make sure you consult with your physician if you have any of these conditions. Serious circulatory problems such as clots or vitis, major cardiac problems such as coronary thrombosis or as known as heart attack, hemorrhage or bleeding, malignant ailments such as sarcoma, active cancer, or leukemia, please talk to your doctor first. Thank you for watching. If you need more information, please go to www.utamas.massagetherapy.com.